Now, a word from our sponsor, Medbridge Healthcare. Medbridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. Medbridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep disorders.
All right, gents, it's another day, another show, and it's time for some pre-cows. What's going on, gents?
Hey, we've got a great episode today. We're in the virtual sleep clinic. I mean, it's a virtual podcast, and we're talking about a virtual sleep clinic. But we have one of the largest virtual sleep clinics that there is in the U.S. and the leadership team from iSleep. We've got Fatima Denney, who's the chief operating officer. She's you know just a powerhouse when it comes to the industry of sleep medicine. I think everyone knows her and has worked with her in some capacity over the years, I would say. And we've also got Dr. Haramandeep Singh, who is the CEO and also the medical director for iSleep, and one of the most fun physicians that you'll find in the field of sleep medicine. I think he's well known, but he's certainly well liked by his colleagues and the people that work with him. But they have developed this virtual sleep clinic that services all 50 states and are really doing some things that are pretty unique for the industry.
It's really incredible to just consider the fact that they're able to have that kind of reach. It's not easy to do, and to build that, and then just the idea of how we've transitioned as a market altogether to this space is incredible. Obviously, COVID made a big shift on that, but the way you're seeing this telemedicine just explode is just something that we would have never thought of prior to COVID. So it's going to be a lot of fun to listen to them and hear them talk about how they came into this and where they're headed.
I agree. I've found that particular piece that you just said, Emerson, extremely fascinating to kind of dive into. How did these companies transform themselves with the onset of COVID, and how COVID forced us to, I mean, I'm not talking about sleep only, I'm talking about medicine in general, forced us to look at virtual a lot more in depth. Before, virtual was not an option. People were like, how could you see patients? How are you going to do this? How are you going to do that? And however, similar to working from home, people are finding convenience with seeing their doctor in the comfort of their home. So I'll be very curious to hear what they say and about the logistics behind that.
Let's do it.
All right, let's do it. On to the show.
Lights out.
Welcome, everyone, once again to the Sleep Tech Talk Sleep Podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Mannikarote. Folks, thanks again for joining us. It's been a fantastic ride. We've hit over 5,000 subscribers here on YouTube, and we can't thank you enough for that. A huge, huge thanks to each and every one of you. We thank you for all the likes, the subscriptions, and most importantly, the shares. It's because of the shares that we are growing, and we thank you so much for that. We also want to give a huge shout out to our sponsors, without whose support we couldn't continue doing this. We're going on year 3 now, and we thank you so much for that as well. And as always, we have a fantastic show, and to let us know what's going on, Robert, what's the show?
Hey, thanks, Jerry. We've got the leadership from iSleep Physicians, the virtual sleep clinic. We've got Fatima Denney and Dr. Haramandeep Singh with us today, and we're very thankful to have them and excited to learn more about the world of the virtual sleep specialist, and we know that's a big part of our future, and we're excited to have them with us. So, Fatima, why don't we start with you? Let you tell us a little bit about how you got into sleep medicine, and then Dr. Singh will circle around to you as well.
Well, first of all, I'm honored to be on Sleep Tech Talk, finally. I've been watching you guys for a really long time, so this is really exciting. So a couple of you guys, everybody on here knows me pretty well. We've worked in the industry for years. I've been in sleep for about 15 years. I started with a company a lot of people know as Watermark/Sleep Med. We sort of went back and forth. We were the largest sleep diagnostics company in the US. We had about 250 sleep labs. We had a DME component. And then we were the pioneers of the Aries Watermark home sleep test device, which is the device that's worn on your head. We were one of the very first out in the market to be the innovators in HST. So that was really exciting. And I sort of got to learn a little bit of everything about sleep. The guy that really got me into sleep was a guy named Gary Lauterbach that started with Sleep Med. He was with them for 20 plus years. And then after being the national director at Sleep Med Watermark, I moved on to Sleep Image, which everyone knows is the home sleep test device that uses the cardiopulmonary coupling technology. And so I was their vice president for a couple years. And over the years, I worked very closely with Dr. Haramandeep Singh that's with us, and he is the CEO of iSleep Physicians. And we worked together for about 12 years plus. And he was one of the pioneers in getting licensed in all 50 states in the country. Always very innovative, ahead of the game, wanted to try new things when all the doctors were too scared, to try them. And so him and I have always worked really well together over the years. And then it just made sense. We were, working so much together with mutual clients that I came on full time as his chief operating officer and executive vice president about a year ago. And it's been amazing. It's been a match made in heaven, and we do some great things together. And, we are now one of the largest sleep, diagnostic or sleep telemedicine platforms in the US. And we do everything that's niche to sleep, from telemedicine consults to interpretations, to anything needed for sleep, on the back end as a back end service. And that's my journey. It's been 15 years of a lot of sleep. So I'm excited to be here. Thank you so much for having me.
Fatima, you forgot industry powerhouse as you were introducing yourself, by the way. Dr. Singh, let's jump in and let you tell us a little bit about yourself as well. You have turned out to be one of the most fun physicians that I've been around in a long time, by the way, because every time I'm around you, you just are in a good mood and bring a lot of life to the conversation.
Oh, appreciate it, Robert, and appreciate being here. Thanks for having us. Again, really honored to be part of this podcast, and I know you guys are growing, got a lot of viewers, so it's awesome to be here. And I got my Hawaii going still because I was in Hawaii a few days ago and just got back. So, I'm pretty laid back for the most part, I think, as well. But yeah, a little bit of my background. Like Fatima said, we've been working together for over 12 years. For me, it was really, I'm board certified in psychiatry as well. And for me, I was practicing as a psychiatrist for a good 8, 9 years or so. And I saw so many patients that had sleep issues, right? And, I realized we're just not taught anything about sleep as providers. I mean, I went through a great medical school, a great residency program in psychiatry, and literally had like 1 or 2 lectures about sleep. So it was that, when you start to see it in private practice and you're seeing it over and over, and then I'm like, we got to do something about this. And I actually started working it up, sending patients to get sleep studies, getting their sleep disorders treated. It was like, whoa, the light went off, man. Like, time to wake up, It's really makes a big difference in terms of their health and their outcomes. And so then I decided.
Is that a sleep joke, by the way?
Yeah.
Time to wake up.
Yes. I had to throw that in there. Yeah. So, and then I wound up doing a fellowship. I wound up at the age of 40, going back and doing a fellowship in sleep medicine at UTSW and training with some of the pioneers there in sleep, and moved out to California, where then I started working with a local sleep lab as a medical director, and it's sort of, developing a sleep practice over time. And so that sleep practice grew quite a bit locally, and then we started also dabbling in telemedicine a little bit, but then COVID hit. And as you all know, when COVID hit, that was it, man. Like 99% of what we're doing is seeing patients online. And it became, and you know, just talking with folks in the industry like Fatima, you know, and others, I realized like this is going to become part of the landscape going forward. And that's where I decided to get licensed across the United States and really start seeing anyone at any time, anywhere, right, in the United States. And then that opened up that sort of, you know, really understanding that you can actually do patients justice. You can actually interpret studies. You can do whatever you need to help other clients also in this industry, whether it's a DME company, an HST company, to really move forward, right? And to work in collaboration. And that's really where iSleep physicians grew. And then Fatima came on board a year ago. And again, match made in heaven. We've been working together so long. We work together, you know, great. And that's probably why I'm smiling a lot, by the way, because she's always there by my side. So
there you go. Is there any limitation from a virtual clinic standpoint in the types of patients that you can treat?
Yeah, that's a great question. So you can actually, you know, as a sleep practitioner, really our job is to get data, right? Historical data, you know, sleep test data. So there's not really much that we can't do in terms of really being able to evaluate a patient online. So we can do A to Z, right? As long as we get that data, right? So the only thing we can't do online is do the sleep study, right? And that's where we have our partners that can send an HST out. We're doing it, or maybe we recommend an in-lab study. But honestly, like 99% of the patients that we see, we can treat online, evaluate them online, and get them treatment, appropriate treatment.
And to add to that, you know, there's a really big need in the dental sleep sector, right? So a lot of these dentists, they're going to need a doctor on the front end to prescribe the home sleep test. They're going to need a doctor on the back end to diagnose it, to interpret the study, to get you that letter of medical necessity and MDRX. So that's been a huge part of our business, is really plugging in with all these sleep dental groups that are doing mandibular device, oral appliance therapy, and really helping them stay compliant from a legal standpoint. And so this is like a big need and a gap. And what's unique about Dr. Singh is back in the day, a lot of the doctors that I work with, you know, they see patients 9 to 5. So they didn't have the time to allocate to just see these patients, right? Get them in these consults and do the scripts and then do the reads in a timely manner. What was cool about Dr. Singh was, you know, he was building this empire where he was like, okay, this is all I do, is I do these consults and I do these interps, and I don't have like a 9 to 5 where I'm seeing patients. Like, this is my job. So that's what's really neat, is that every single month at iSleep Physicians, we are adding providers. We're growing. And so we provide same day consultations for all of our clients, right? Same day, next day. And there's not a lot of telemedicine platforms in sleep that can offer what we offer, right? And have the quick turnaround for the sleep interpretations, because that's literally all we do. This is our main focus, and this is very niche. Nobody does this as just a full-time gig, and that's what makes us stand out.
Well, with that in mind, Fatima, can you take us on the patient journey? You know,
Yeah.
how they find you to therapy, and then maybe even kind of take us on the path of what happens to a CPAP patient and a dental patient, because those can be very different from each other.
For sure. Absolutely. So we are not really, we are a B2B. We're not really a B2C. So we are not reaching out to those patients. So we work with some of the biggest players in the market that are doing sleep testing. So think IDTFs, think DMEs, think, you know, the sleep testing companies, sleep labs, dental groups, mandibular device, oral appliance groups. These groups all need these niche services that we offer. And what's nice is we're in the background. So we're like a back-end service. So we will do all that hard leg work, all that legal, all the paperwork that you need. And so from a dental perspective, what we do is we offer these packages where the patient gets the questionnaire, right? And then the patient gets a face-to-face with one of our sleep providers. After our sleep provider has that face-to-face, goes over the questionnaire, identifies that that patient needs a sleep test, writes a prescription for that sleep test. The patient goes, grabs that sleep test either from, you know, one of the companies that we work with, one of the third party companies or from the dental clinic. And then the dentist would, we would actually interpret that study, and then we would have a post consultation where we'd go over the sleep study results with that patient. And then, you know, then they start their journey of oral appliance therapy. With CPAP, it's a little different. You know, with CPAP, we will still do the consults as needed, the pre and the post. And then on the back end, we write the CPAP script, whether it's APAP or whatever it is. We have that post consult, and then we actually follow that patient, right? So we'll follow that patient, make sure that they're staying compliant. We work with a lot of our clients that also, you know, that we're doing RPM with or ongoing monitoring. So these are services that we have time to really focus and hone in on, because like, as I said, we're not seeing patients 9 to 5 in a clinic. This is all we do. This is our niche. So it's a little different for the dental client versus the CPAP, but for the most part, it's the same. A lot of insurances now are requiring, even for CPAP, a pre and a post consult. And we do the same thing for the oral appliance, especially now, you know, it's a lot of these large payers are following Medicare. So Medicare, you know, wants to see those face-to-face with the sleep provider.
Are you a sleep tech looking for new opportunities? Well, Medbridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with Medbridge Healthcare. Now back to the show.
So kind of piggybacking on that piece that you talked about, consult, and Doc, this question's for you to better understand that. To go a little more in detail, you said it's all about data. And, you know, back in my days, ancient days in medical school, we were taught about 80% of the diagnosis can be just done at history taking. Could you talk a little bit about that? Because we all know if it's in the office, in the clinic, typically it's about 11 to 15 minutes a patient sits with a physician, and, you know, it's not always the most satisfying. Could you tell how it is on the virtual side?
Yeah, absolutely. I mean, just to add a little bit also to what Fatima said. So one of the things that, you know, we've incorporated technology as well in terms of getting patients quick appointments, so they can actually schedule online, right? So they're sent a link and they schedule online, and that's really key in terms of being able to get them in quickly and be able to see them quickly. And in terms of, you're right? So generally speaking, if we get the history, and so again, we get a questionnaire, we get that data, you know, we review that questionnaire, and getting further history from the patient just on a virtual visit, right, allows us then to go forward and say, hey, these are the markers, the symptoms that we are looking for in a patient that may have sleep apnea, that may have REM behavior disorder, that may have narcolepsy, right? And so we can do that fairly quickly, right? So, and then again, it comes back to, like, if you're in the office, right, our physical exam is limited as sleep specialists, right? We're not dermatologists here, like evaluating skin. You know, we're not a surgeon who's going in trying to remove a tumor and having to, you know, really find out what else is going on physically with the patient. So our physical exam's limited, it's short, and as a result, you know, we can do that visit efficiently, spend enough time with the patient so that they understand. And a lot of what we do is education, right? Because again, like, not a lot of providers, patients out there know anything about sleep or actually, you know, realize the impact of sleep. And so that educational process also is really important and parcel of our consult, right? To be able to disseminate that information. Hey, if you're at risk for sleep apnea, risk for these comorbidities, or you may already have these comorbidities, right? They may get worse over time. So doing that educational part, you know, that's one thing that we really value. And in terms of, you know, our providers, they get it, right? And they get it in terms of also helping the patient understand how sleep is so important, how it can impact them. So, you know, I think it comes down to, you know, whether you're in the office or whether you're doing a virtual consult, you know, it's really about that small amount of time you might be spending with the patient, whether it's 10 minutes, you know, whether it's 15 minutes, and being able to, like, incorporate that data quickly and be able to disseminate that information about why we're doing a home sleep test, What are your results? These are your treatment options, right? So, and I found it to be very efficient, and patients love it actually because, you know, they don't have to drive anywhere, right? So they're in their home or wherever they're at, and that, you know, and it gets done quickly and they're satisfied.
Well, you know, it's interesting, you know, especially being a psychiatrist, I'm thinking of complicated patients, you know, and especially now you know, we see more talk about RBD and that sort of thing. What happens in that patient journey if you really begin to dig into a complicated patient that you wish was sitting on the table in front of you for you know, the interview? How do you navigate those difficult complicated patients?
Yeah, no, it's a great question because yes, the complicated patient, you know, and what people, you know, what I've learned as a practitioner is that with sleep, there's always comorbidity, right? So you have patients that have depression, you got patients that have OSA and they have narcolepsy, right? Which is a common uh, combination or RBD. So yeah, with that complicated patient, you're right. We do need to go a little bit further. We need to get a little bit more in terms of their history, spend a little bit more time with them, right? And then, of course, some of those patients, when, you know, and nowadays we know that in terms of home sleep testing, look, that is what the insurance is going to cover. Okay. You know, we can document and try to push for an in-lab study, but it's not going to happen. Okay. So it's the first step. We got to do it. So we talk about, hey, listen, we're going to be looking at it. We're doing a home sleep test, but there's limitations here, right? So let's say you come back and it's normal, or you got mild sleep apnea. We may have to go a step further. We may have to fight your insurance to get an in-lab study done, do an MSLT, that sort of thing. But I think the key with a complicated patient is that, number one, you have the knowledge base, of course, to understand their symptoms, right? And move a step further in terms of educating them that, hey, this is what's going on with you, and then spending more time with them. Those complicated patients, there's no doubt you have to spend more time with them. You know, and then we carve out that time, right, for those patients and make it happen.
So I actually have two questions, and I want to get them in before Jerry starts to cut us off from for the end
Already?
of the podcast. Yeah, I know. Well, it goes by quickly.
Jeez, Jerry.
So my two questions. One would be so maybe Fatima, this would be for you. You know, the application of remote patient monitoring as part of the practice is that something that you do today, or is it part of the plan for the future? And then Dr. Singh, you know, we talked about this a little bit earlier that, you know, there is the potential in some cases in some markets for a virtual clinic to support the services of a sleep center or even a sleep practice to add additional providers to that practice, albeit remote and through the virtual channel. So, Fatima, I'll let you go first and talk about the RPM.
All right. I'll touch on both of those because Dr. Singh will also add on the RPM. So, you know, one of the services that I didn't mention that we do, this is to your second question, is, you know, a lot of these sleep labs reach out and say, we have a doctor retiring, or we have a doctor that's going on vacation, or we have a lot of gaps throughout the year, right? And so we need a sleep doctor to do interps and consults, or maybe act as medical director for the next 6 months as we look for someone new. That is something that we do. So part of iSleep Physicians is not only do we have MDs and we have, you know, advanced practice providers, so we are able to do that, and that's something that we've done for over a dozen clients. And I'll let Dr. Singh. And yes, we are add on that. Yes, we are doing RPM currently, and we are, you know, always finding new companies that are doing RPM and learning about them and how they're different. And some of them, you know, bill for different components, and some of them, you know, offer different things. So it's really neat seeing how the sleep world is evolving and all these new companies are popping up, and you know, all of the different things that we're able to do today for ongoing monitoring and RPM. And I'll let Dr. Singh talk a little bit more on what we're doing on RPM.
Yeah, I know exactly. I mean, I think RPM is the wave of the future, honestly, right? I mean, if we can prove that by monitoring folks that have chronic conditions like sleep apnea and they're compliant with their CPAP, you know, that is going to be the biggest thing in terms of payers then saying, oh yeah, we're going to cover this, we're going to cover that, and we're going to make sure that these patients stay out of the hospital, right? And that's the goal, right? So I think it's coming. It's here already. There's a number of companies popping up, like Fatima said. We've been doing it on a local level with our local patients now for over 5 years, right? And it's great because they actually buy into the service, right? Meaning like they want us to monitor their CPAP data. They want to see how effective it is if they have high leaks, right? And then there's red flags that pop up too, which we can then handle, right? And take care of that patient quickly if needed. So we've been doing that. Our goal is definitely to expand on that. We're talking to other companies now in terms of how they can assist us with that process. And then also chronic care monitoring, right? So we're definitely going to expand in that area, no doubt. And then in terms of your other question, yeah, we've already been working with hospital systems, for example, right? There's probably over a dozen hospital systems that we're working with that need providers, right? Maybe it's a short-term thing, or it might even be a longer-term thing, right? They just can't get enough providers. And as a result, we provide them the providers, we do the interpretations, and assist them in that way. And so I think that need is just going to keep growing. There's not enough sleep specialists out there, right?
No.
So it's just going to keep growing, and really that's what we do, right? That's our niche, and so our goal is to help anyone that needs that.
And just going into the future, a lot are not going into sleep now. A lot are not going into sleep because they don't have the option to sort of like tag that on the back end, correct, Dr. Singh?
Yeah, absolutely. We've seen a major shift. For example, when I first went into when I did my residency in psychiatry, I mean, it was not that difficult to get a residency in psychiatry. It was maybe difficult to get into Hopkins where I went, but the point was that it's not easy to get in. It wasn't that difficult to get into psychiatry, get that residency. Now it's very difficult, right? Because we've seen TMS and other procedures that have come on board where psychiatrists can do and get really large reimbursements for those, right? But when I went, but back then when I went to psychiatry, it was very difficult to get into sleep, right? Because the sleep lab was the standard, and everyone was getting an in-lab study, and sometimes for multiple nights, right? And we've seen that shift now. We've seen the exact same shift in terms of medical students and which specialties they're trying to get into, and it's a lot easier to get into sleep, but there's not a lot of people going into sleep. Yeah.
Well, Doc, thanks. Fatima, thank you so much, but we are out of time. But before we close, is there anything that you want to add? Where can people find you and get more information about you? And anything else you'd like to add?
Yeah. So, just to mention, we are in all 50 states. A lot of people think that we're local just in California. Our entire company is remote. I live in Scottsdale, Arizona. Dr. Singh's in California. Our providers are all over the country. You can visit our website at iSleep Physicians and learn a little bit more about what we do and our services that we offer, and how we can work together. We also have like a Q&A section if you have some questions, or you can reach out to us directly.
Awesome. Doc, what about you?
Yeah. It's you need to find us 888 MD Sleep. That's what you can call actually. Or go on our website, like isleepmd.com. But I would like to just thank you all again for this opportunity to really be able to share our experiences. And I just see our niche and what we're doing really keep, I see the growth in the future, and I'm looking very forward to be part of this, and it's great to have Fatima on board finally with me in the same company.
All right. Well, thank you, folks. I appreciate it.
Thank you, guys.
Thank you. And
we're honored to be here.
Hey, it was an honor to have you both. Folks out there, thank you so much for joining us once again on this fantastic episode. We thank you so much for your support, for all the likes, the shares, the subscriptions. Thank you so much for that. And to our sponsors, once again, a huge shout out and a huge thank you for all that you do for us. And everyone else, we just want to say stay tuned until the next show. But until the next show, lights on.
Before we go, we would like to thank our sponsor, Medbridge Healthcare. Medbridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose, and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
All right, now that was a show. We had a power couple, sleep power couple, let's put it that way, on the show. Wouldn't you agree?
That is energy and innovation that have just come together. I mean, you've got so much energy and innovation with those two individuals. Fatima's history and sleep, Dr. Singh's, and blending those two together to make such an incredible company that is so far reaching, as we talked about in pre-cals. Hearing their story, what they're doing, where they're going, it's just fascinating to see something that, as we talked about in the beginning, was just unthought of, unheard of. And now it's becoming so mainstream, and they're really leading the way in that space.
When we have talked about sleep clinics and patients' availability to get into a sleep clinic on other episodes, we've talked about the long backlogs and we identify these patients who have a significant problem, and then it's 6 or 8 weeks before they can get in for a consult. So the idea of being able to sort of supplement the physical sleep clinic with a virtual clinic, I think should have a broad appeal to anyone who's listening to this program, and they should consider it as a potential expansion of their sleep service.
It's a very good point that you made there, Robert. And I like the fact that the convenience factor where Doc explained that you don't even need to call in or whatever. You can choose your own appointment with their model. The patient can just choose their own appointment, whatever's convenient for them, and everything is done virtually. I think that's a huge shift from we were at the mercy of everybody else, and now we have this opportunity to take our health in our own hands, so to speak, with such a model.
She gave us a lot of different sort of options that patients have to get on their schedule.
Right.
At some point, maybe it's an on-demand sleep consult. I mean, wouldn't that be pretty amazing to have the ability to log into their app or their website or what have you, and do a sleep consult on demand?
I think that's where the future may be headed, right?
Well, it's incredible, even thinking about the lab coat effect. So many patients, when they get in front of a doctor in that setting, have such a negative reaction to it. It'd be interesting to understand at some point how this is transitioning that, so that the patient is feeling more comfortable in their own home, having that conversation with the physician or nurse practitioner and PA. It'll be interesting to understand that at some point. What does that transition look like? And how does the patient act, and how does it affect them? And do they end up being more natural in front of the physician than they would have been sitting in their office? So something to wonder about and maybe ask someone about in the future.
I agree. And I think that's a great place to stop. You guys want to call it?
Let's do it.
Yeah.
All right.
Thanks, Fatima. Thanks, Dr. Singh. We appreciate you guys being with us.
Yeah.
Amen. And folks, we thank you all so much for joining us once again. So until next time, cheers.